Hello, I'm Dr. Nisha Sujata. I'm working as a specialist gynecologist in Saha Al Shifa Hospital, Rola. Today's topic of discussion is about pelvic floor dysfunction following childbirth, or rather, we can say it as how to heal after childbirth. First of all, we should understand about what is pelvic floor, then only we can explain about pelvic floor dysfunction. Pelvic floor is a group of muscle that forms a layer covering the lower part of the pelvis, which supports the organs like uterus, urinary bladder, and the bowel. The pelvic floor can get damaged during the childbirth, during the process of childbirth, during pregnancy, during the wound inflicted during childbirth like episiotomy or even perineal tears. The problems that can be associated with the pelvic floor weakness or the pelvic floor injury happening during childbirth is basically because of the weakening of the muscles leading to incontinence of the urine, incontinence of the feces. Then there can be urgency in urination. There can be low back pain, which may be chronic, lasting for several months. There can be pelvic pain, also difficulty in sexual intercourse. In the long run, there may be a mass women notice in the vagina, a mass in the lower part. We call it prolapse. That can come even after several years following childbirth if not properly into consideration the problems. In addition to the above problems, there may be associated depression, isolation, anxiety, and lack of good quality of life in these women. How to deal with it is basically pelvic rehabilitation therapy. Pelvic rehabilitation is basically the strengthening of the muscles that have been damaged during childbirth. We can advise women up to 6 weeks to have lighter exercises, walking and all, and after 6 weeks they can do strengthening, stretching exercises and walking, swimming, etc. Another part is like behavioral modifications. If they have urinary incontinence or fecal incontinence, they can just hold it for a few more seconds, and every time they can increase the duration of the seconds by tightening it more. There are other surgical options for this, like plasties. We have perineoplasty, vaginoplasties, majoroplasties, and even non-invasive techniques are also available nowadays. Any women facing any of these difficulties can visit the gynecological department at Saha Al Shifa Hospital, Rola, Sharjah. Thank you.